Should you fix old filler or leave it alone? What doctors consider. This channel provides evidence-based education on cosmetic medicine, injectables, lasers, and skin science. You had filler months ago, or even years ago. And now you are wondering, should I dissolve it? Should I just leave it? Or should I add more to fix it? The answer is not simple. Because in many cases, doing nothing is actually the best option. Today, I will explain how doctors think through this decision. Let's start with a common misconception. Many patients believe that if there is old filler, it must be removed. But that is not always true. Old filler can be stable. It can be well integrated. And it may not be causing any problems at all. So the real question is not whether filler is present. The real question is whether it is causing a problem. Now, let's talk about when doctors leave old filler alone. There are many situations where we do not treat. Second, if the aesthetic outcome is still good. If the face looks balanced, natural, and proportional, then dissolving may not provide any benefit. Third, if the filler is deep and stable. Some filler sits deep on bone and becomes well integrated into the structure. Trying to remove it can actually disturb that support and create unwanted volume loss. Now let's look at when old filler becomes a problem. Because this is where intervention may be needed. One of the most common issues is swelling, especially under the eyes. Patients may notice intermittent puffiness, fluid retention, and symptoms that are worse in the morning. This is commonly seen with tear trough filler. Another issue is lumps or irregular texture. This can happen due to superficial placement, partial breakdown, or uneven distribution of product. Migration or spread can also occur. Over time, filler may shift slightly. For example, from the cheek into the under eye, or causing blurring of the lip border. And then there is overfilling. This is often due to repeated treatments over time. The result is heaviness, loss of contour, and an unnatural appearance. So what do doctors actually do when there is a problem? We do not jump straight to one solution. We usually consider three main options. The first option is to do nothing and observe. Sometimes the symptoms are mild, or temporary, and may settle without intervention. The second option is to adjust without dissolving. This might involve adding small amounts of product strategically, to improve balance rather than remove volume. Not every problem requires dissolving. The third option is hyaluronidase, which is used to dissolve filler. This is considered when there is a clear complication, a poor aesthetic outcome, or a functional issue such as persistent swelling. But it must be done carefully. Now let's talk about the risks of dissolving. Because many patients think it is simple. It is not. First, there can be volume loss. Removing filler can lead to hollowing, and can actually make the face look more aged. Second, removal may be incomplete. Especially with older filler, or filler placed deep. Multiple sessions may be required. Third, there can be tissue changes. Sudden removal of volume can affect tissue support and change how the skin appears. So how do experienced clinicians make the decision? There is a framework. Step 1 is to identify the problem. Is it swelling, shape, or simply perception? Step 2 is to confirm whether filler is actually present. This is done with clinical examination, and sometimes imaging such as ultrasound. Step 3 is to assess the risk versus benefit. Will dissolving improve the situation, or could it make things worse? If you remember three things. Old filler is not automatically a problem. Dissolving is not always the best solution. And good decisions require proper assessment, not guesswork. In aesthetic medicine, more treatment is not always better. Sometimes the best decision is restraint. Because understanding when not to treat is just as important as knowing how to treat. Thank you for watching. We hope you found this helpful. Don't forget to like, comment, and subscribe for more.